Here is a short video to guide you through the correct process for taking a wound swab. A wound swab should only be taken if there are signs the wound is infected. Clinical signs of infection would perhaps be the wound is red, hot, or painful, beyond what is expected for normal healing, and/or the wound is discharging pus. If present, pus is a better specimen than a swab. If you have electronic ordering, follow your local procedure for this. Firstly, we need to gain consent from the patient to take the swab. It's important that the healthcare worker explains that they are taking the swab because they suspect an infection and they need to find out which pathogens are causing the infection so the patient can be treated with the correct antibiotics if an infection is found. If possible, it is best practice to take a swab before antibiotics are started. We then need to gather all the equipment we will need to take the swab. This will include PPE, saline, wound swab, microbiology request form if applicable, and any wound dressing equipment as described in the patient's wound care plan. Ensure the patient's privacy is protected by closing curtains and shutting doors. Decontaminate hands using soap and water or by using alcohol-based hand rub if hands are visibly clean. The healthcare worker will need to apply PPE. Please follow local policy around aseptic non-touch technique for wound care. The healthcare worker will need to remove the previous dressing and cleanse away any dressing material and excess exudate following the wound care plan. Remove gloves, decontaminate hands and apply clean gloves before moving on to taking the swab. Using a non-touch technique, remove the swab from the packet. If the area to be swabbed is relatively dry, the swab may be moistened using sterile sodium chloride, taking care not to touch or contaminate the swab. This will help to ensure that any organisms adhere to it. Swab a representative part of the wound using either A zigzag action from the center outwards while turning the swab over in a circular motion, or B, rotating the swab over 1 square centimeter of the wound. Use enough pressure to ensure the swab is soaked with wound exudate. Insert the swab into the tube containing the culture medium, still using a non-touch technique. Continue to redress the wound following the patient's wound care plan. Remember, you will need to apply fresh gloves before applying the new dressing. Please ensure you have cleaned your hands before applying fresh gloves. Remove the gloves and apron immediately after dressing the wound and clean your hands. Immediately label the tube stating the site that was swabbed and the patient's details. Dispose of all equipment following local guidelines. Complete the microbiology request form if applicable, ensuring all details are entered correctly and completely, including replicating what is on the wound swab label itself. It is useful to state what sort of wound it is, for example, a surgical wound or a leg ulcer, to record signs or symptoms of infection, and to specify any current or recent antibiotics. Any missing detail could lead to the swab not being processed. Send the swab and form to the microbiology laboratory for analysis as soon as possible. If the transport to the laboratory is delayed, place it in a pharmaceutical fridge. Document the procedure in the patient's notes, noting the date and site of swab taken. Please remember, only swab a wound if there are clinical signs of infection or it has been requested by a healthcare professional leading on the patient's care. Serous ooze is not a sign of infection and could lead to unnecessary antimicrobial prescribing if the wound is colonized or contaminated.